Greetings, loved ones. Today we're going to talk about different treatments for trauma. Help us get these messages out. Please subscribe to our channel, follow us on Facebook, Instagram, and Twitter, hit the like button and the notification bell, and please share these messages with others. You never know. By doing so, you could save a life. Okay, treatment. The effects of trauma can be treated by a mental health professional such as a psychiatrist, psychologist, or a therapist. Psychotherapy or talk therapy is the primary treatment option for trauma. But there are types of psychotherapy that focus specifically on trauma, such as trauma-focused cognitive behavioral therapy, which are effective in treating trauma. There's a program called eye movement desensitization and reprocessing, EMDR. This is a method that involves small controlled exposures to elements related to the traumatic experience to help overcome the trauma. So in the different types of mental health therapy, there are treatment plans for those with PTSD, which regularly include medications to help with mood and sleep. In addition to professional support, there are many strategies that can be used to cope with and overcome trauma. Talking and spending time with trusted family and family members and friends, that can be really helpful. There are also support groups specifically for trauma. And it is also important to maintain routines, eat regularly, exercise, get enough quality sleep, and avoid alcohol and drugs. And stress. Stress plays a role in trauma. So stress management and relaxation can make a big difference. So when do you know that you need to seek professional help? While trauma can be a normal response to a distressing situation, it is sometimes important to seek professional help. And there are things that can be done to alleviate symptoms and provide support for coping and moving forward in life. Additionally, without professional help, it is possible for symptoms to escalate and become life-threatening. Anyone who is experiencing symptoms of trauma that affect daily life should definitely seek help from a psychiatrist, psychologist, or other mental health professional. Trauma increases the risk of PTSD, depression, suicide attempts, anxiety, and misuse of substances. So it is a serious mental health concern. So there is a suicide prevention hotline. If you are having suicidal thoughts, contact the National Suicide Prevention Hotline at 800-273-8255 for support and assistance from a trained counselor. We have posted this number in the description of this video. If you or a loved one are in immediate danger, call 911. For more mental health resources, see their National Helpline database. So trauma is an emotional response that is caused by experiencing a distressing or traumatic event. This emotional response may be present only during and right after the traumatic event, or it could be prolonged. Some traumatic events, such as child abuse, may be ongoing, or a person may experience complex trauma, which is exposure to multiple traumatic events. Symptoms of trauma can be both emotional and physical and include feelings of fear, helplessness, guilt, mood swings, behavior changes, difficulty sleeping, confusion, increased heart rate, and body aches and pains. It may also become more serious as those who experience trauma may develop PTSD and are at an increased risk of suicide. Treatment is available. A mental health professional may provide psychotherapy and other support to overcome the trauma. And it is really important to seek help if trauma symptoms begin to impact your daily life. Living through traumatic events and the emotional response of trauma is distressing and challenging. If you or someone you know is experiencing trauma, help is available. Reach out to trusted friends and family members for support. If symptoms are impacting your daily life, if support from friends and family is not an option, or if you need additional support, contact a mental health care professional. With treatment and coping, It is possible to overcome trauma. So let me ask the question, can you have trauma but not have PTSD? It is possible to experience trauma without having a post-traumatic stress disorder. When a person experiences a distressing event, they may experience trauma, which is a long-lasting emotional response to that event. PTSD involves flashbacks, nightmares, avoiding situations connected to the trauma, and ongoing symptoms and psychological arousal. So how do I know if I have emotional trauma? Emotional trauma is the emotional response to experiencing a distressing event. I know I keep saying this over and over again, but it's a complex situation that I want you to understand. So this trauma can be diagnosed by a healthcare professional such as a psychiatrist or a psychologist. Some signs and symptoms of emotional trauma are feelings of hopelessness, anger, fear, disbelief, guilt, shame, sadness or even numbness, mood swings, confusion, disconnectedness, self-isolation, and experiencing the 5 stages of grief and trauma. You know, when we are experiencing these things, it's important that we seek help. And I want you to know that if you are a victim of violence, that there is help. The question is not if you will encounter a victim of violence. The question before God is, what will you do when you do encounter them? You could be a person who saves a life. You're a champion. We are all called to be champions for justice. And those who suffer violence, they need to know that those who love them and those who don't even know them will reach out and help them before it is too late. If you're a victim of violence, please listen to me. I want you to know that you are valued, you are loved, you're intelligent, and yes, you are worthy. God does not want you to suffer violence. He loves you, and He wants you to live free from violence in peace and tranquility. I want you to know that there is a way out. It is not your fault. Abuse is not love, and you are not alone. If you're a victim of violence, please reach out to somebody today. If you are in a dangerous situation, dial 911 for help. If you know of somebody who is suffering trauma or abuse, give them help and alert the authorities. In our next episode, we're going to talk more in depth about trauma and the different types of trauma and symptoms and treatments. Until then, God bless you.